So the best exercise for herniated disc, as you've read in the book, when the disc herniates, there's a bulging effect that occurs towards the back of the disc. Remember, the disc is thinnest at that back outer corner of the disc. So the objective for us is to try to get that bulge to move back in. When you flex forward, remember, when you bend forward, you pinch the front of the disc, and that bulge gets pushed backwards. So press-ups are meant to do exactly the opposite. You're trying to do exercises to try to get that bulge back in. And over time, if you can reduce that, remember, if your symptoms are reproducible, they're reducible. So if you're getting symptoms down your leg and you do press-ups, you can actually reduce the size of that bulge and, of course, reduce your symptoms. So, so the exercise you want to be doing is either a standing backward bend or a prone press-up. So standing backward bends, essentially hands on the hips, you're going to bend backwards, and you can pause for a second or two and then back. Okay, boom, pause, and then back. Pause, and then back. That's pretty much it. 10 reps, maybe 3 or 4 sets of 10. Okay, the objective is to try to, if you are experiencing sciatica and it's down here, you do 10. We call this centralizing your pain. You do 10 and maybe it moves to here. You do 10 more, it moves to here, 10 more to here, then maybe 10 more. It actually centralizes just in your low back. The better of the two are the press-ups, the prone press-ups. And I've seen a lot of this stuff online is the best exercise for sciatica, and it probably is. It's probably the easiest way to try to reduce that the size of that bulge. So you start flat, hands flat, like you want to do a push-up, but you can do what we call, as I said, a press-up. You're going to extend upwards, and you don't want to be using your back muscles or your butt muscles to help with this. So maybe put my feet over the edge of the bed, the table here, the bed, at home, and you're coming up, pause for a second or two, back down, up and down. Okay. Some people just kind of kiss, that pain there, then back down. You don't want to just force through the pain. You don't want to hit that, spot and then get this excruciating sharp pain down your leg. You want to respect it, so you kind of kiss it. You can pause for a second or two, then back down. And the same idea happens here. When I go up to this point, maybe try to keep your pelvis down as much as you can here. I don't want your pelvis to come off like this. You're extending your back, no muscle activation in your back or your butt. Arms do the work, and up and down. 10 times, repeat, like I said, 3 or 4 sets of 10. If you're experiencing sciatica, you're trying to centralize the symptoms as you come up. The other thing, too, I just want to mention here, this idea is if you have an unstable disc, and that disc is, it's coming out, it's going back in, it's just not stable enough to maintain its position. As you come up, you want to make sure you don't go back into flexion again. So you come up this way, maintain your extension, kind of stick your butt out, maintain that extension, maintain the extension, get yourself off the table, maintain the extension, and then come on back up again. If you start to experience an increase in symptoms standing again, then after doing press-ups, go right back to your backward bends again, okay? You can follow this with the traction we talked about. That's in the other videos, tennis ball massage, and then your stability work. So, but this is the best exercise for a herniated disc. So that's it. Thanks.